The concern with BPH that is untreated leads to the long-term effects that it can have on the bladder. What happens is the prostate enlarges and obstructs the flow of urine from the bladder. The bladder compensates by stretching out and getting bigger as a muscle. And as it does that, those muscle fibers stretch out and you get some remodeling of the bladder wall with some scarring or fibroblast placement between those muscle fibers. And that stiffening is what explains a lot of the urinary symptoms that a man gets. Additionally, as the bladder stretches out and tries to compensate for that increased resistance, it ultimately begins to fail. It manifests that by not emptying completely, and so men will urinate frequently but only empty a portion of their bladder. Additionally, you can have urinary tract infections due to the stagnant urine that's there. And ultimately, you can end up with kidney failure as a result of upstream increased pressure due to failed bladder emptying. Finally, some men will develop bladder stones. This only worsens a lot of their urinary symptoms. And the bladder also can develop diverticula, or little outpouchings in the muscle wall, which oftentimes require surgery to repair, especially in the setting where a man is having recurrent urinary tract infections. So all in all, BPH, or benign prostatic hyperplasia, very common condition affecting men, beginning as early as age 30 or 40, but certainly as a man increases in age, the prevalence increases as well. Another final important thing to note is this is different and unrelated to prostate cancer. So having an enlarged prostate does not predispose you to prostate cancer. Many of the symptoms can overlap. There can be some concern with PSA elevation, and we'll try to address these in a future talk. Hope you have a good day. We'll talk to you later.